Good morning, everyone, and thank you all for joining us. First, while we watch other parts of the country continue to count votes, it's worth noting the extraordinary turnout here in Denver and across Colorado, where our efficient, safe, and accurate voting is the envy of the country. Our voters deserve a tremendous shout out. Thank you for voting. And we also want to send a special shout out to our county clerk and recorder, the Honorable Paul Lopez, and the election director Jocelyn Bucaro, and their teams for executing a wonderful election for all of us here in Denver. Regardless of the outcome, as we watch the national results come in, this election comes at a challenging and emotional time for many. I see and appreciate the restraint and respect I've seen this week from our residents. While voting is over, here in Colorado at least, the COVID-19 pandemic continues. I'm not going to mince any words here when it comes to the spread of the coronavirus. We're on a very dangerous path. We're seeing rapid, significant increases in the numbers of people getting sick, and many of those people ended up in the hospital. And this has been the situation for the past 40 days, creating a sustained and worsening situation. Across the state, including here in the metro area, hospitalizations have increased over 40% in just the last week. 40%. Colorado has made a new top 10 list. This one's for COVID, with the 6th highest rate of increase in cases and hospitalizations. This says something, given the entire country and much of the world are seeing the virus come back with a vengeance, as predicted for the colder season. We bent the epic curve once before, and we need to do it again. Yesterday, I was on the phone with other mayors and public health officials from across the metro area to share ideas and to urge a regional approach. We bent the epic curve with a stay-at-home order earlier in the year, and it was successful because our residents understood it was a public health order designed to save lives. Another stay-at-home order is still a tool in the toolbox, particularly if there is any significant risk that our healthcare system could be overwhelmed, as we saw in New York City and northern Italy earlier this year. I want to be clear, very clear with everyone. With how it's going now, there's another stay-at-home order in our future unless we act with urgency and care for one another to change the behavior that is leading to these increasing cases. When we don't wear masks, when you and your friends get together in a big group with no social distancing, what you're saying to everyone else is my bad decisions are more important than your family's health. You're saying that your bad decisions are more important than your favorite restaurant staying open. Our restaurants and businesses have gone above and beyond, putting the necessary health and safety measures in place to slow the spread of the virus. For the most part, regulated spaces are not the problem. It's people getting together in social settings in unregulated spaces. But it will be our favorite local businesses and our individual ability to be together with others that suffer the consequences of bad decisions and unsafe behavior. We need everyone working together to reverse this trend. I'm going to say that one more time. We need everyone working together to reverse the trend. I met with Dr. Birx, the coordinator of the White House Coronavirus Task Force. She is traveling across the country to give sound and thoughtful public health advice to mayors and governors. Her advice is sobering. Based on what she's seeing around the country, we need to discourage large social gatherings. We need to discourage people from different households from getting together. And we need to significantly increase testing, particularly rapid testing for asymptomatic young adults. Dr. Birx agreed that while the blunt instrument of a stay-at-home order was necessary earlier this year, it can be avoided if we're successful in changing our habits and behavior, particularly younger people between the ages of 18 and 35 who are asymptomatic and yet are spreading the virus. I asked Bob McDonald and the staff at DDPHE to look at creative but meaningful ways we can employ public health orders to move COVID-19 numbers back in the right direction. One step we're announcing today is what we're calling a home by 10 order that will restrict nighttime business hours, particularly for bars, clubs, and restaurants, and urge residents to be in their own homes and not gathering or mixing in other households. I know that some on the line may want to characterize this as a curfew, but that's not how we are characterizing it, and it's not how our public health order is framed. This isn't a public safety measure. This is a public health measure, enforced like a public health measure and targeted to deal with the behavior that is contributing to the virus spread, namely among younger asymptomatic adults gathering outside of their homes and unknowingly infecting others. Restricting hours where alcohol can be consumed is another part of the overall strategy, since human nature being what it is, people become less careful, less inhibited, the more they drink and the later they are out. This order, which will take effect on Sunday, is meant to encourage, at least for the next 30 days, people of all ages to steer clear of gatherings outside of their own home. Obviously, we are aware that Thanksgiving falls within this time frame, and we're not going to sit here and tell you that Thanksgiving is canceled in Denver. It is not. But I'm going to urge everyone to think differently about Thanksgiving this year. Now, all of you on this line know that I come from a very large family. And every year, one of the great traditions in our family is that Mary Louise and I prepare dinner for our family. And on Thanksgiving Day, we can have anywhere from 40 to 60 people in our home. Unfortunately, due to COVID-19, this year we will not be hosting that gathering. We decided that it is safer for everyone to stay in their own homes, to enjoy each other's company in their own homes, and we will be doing this virtually, together as a family, bidding happy Thanksgiving to each other instead of being together in one home. I know this isn't what anyone wants to hear right now, but our goal is to avoid another stay-at-home order if at all possible. In addition to limiting social gatherings and restricting activities after 10 p.m., our new public health order will do a few other things, and I want to share those with you now. It prohibits spectators at high school and college athletic events. It halts recreational athletic events. And for 30 days, it will close bars that are not able to meet some basic criteria around mingling and food service. Finally, one last step. As you saw announced by the Denver Department of Public Health and Environment at the beginning of this week, is more aggressive enforcement will also take place. We know we can't enforce our way out of this pandemic. That's not what this is about. As I said to you all in March and April, when you asked, Mayor, how are you going to enforce this? We were able to bend the epic curve because at that time, as I explained then, this is less about enforcement and more about responsible citizens and residents deciding to take it upon themselves to say, I've got to not only keep my family safe, I've got to keep my neighbors safe. And so I must do what's necessary the next 30 days to help get Denver and this metro region back on track to save lives. I want to say that again. This is not about enforcement. It is about all of us recognizing we have a responsibility to not only our families, but to each other to help save lives. Public health orders require the public to cooperate and to comply. We have stepped up our compliance and enforcement efforts before, and we will continue to do that again. But we don't want that fork in the road to lead us to a complete lockdown. We know there's no place like home for the holidays, so when you can, stay home. And maybe more of us can be together this holiday season. And I'll just say this as I get ready to turn it over to Bob McDonald. As we said back in March and April, today I'm inviting everyone to do what we need to do so that we can do what we want to do in the very near future. I'm inviting the people of the city and this region to join together, to take up the mantle of personal responsibility to do what you have to do so we can do what we want to do in the very near future. Now, I'm going to turn it over to our Public Health Director, Bob McDonald. Bob?
Yeah, thank you, Mayor, and good morning, everyone. I want to share a short slide deck here so that just to do some level setting, and I'll go through them quickly so that we have enough time for Q&A. So hopefully the slides are advancing and you can see this, but you've seen this many times. This is the epidemiological curve for this virus. We've tracked that, the case counts from day one. And you can see where we are here, looking at this chart, what the threshold is for getting back to a safer at home allowance. And you can see what the threshold is for a stay-at-home order, and this is off the state's dial system. And you can see here that we have far exceeded the number of cases that would be the threshold for a stay-at-home order. This is not the only metric that's looked at, and so we are not being placed under a stay-at-home order, and we want to avoid that. I would also share with you that while it's not on this slide, I had heard that just last night in the last 24 hours, we saw an additional almost 700 cases in the last 24 hours. This is the state style. And again, these are the three primary metrics that we look at, that the state looks at. It drives much of the decision-making process. And you can see here where we stand, not yet in the stay-at-home phase with these last two metrics, but hospitalizations and positivity rate is going up. And in fact, if we don't turn the trajectory of our cases, it's projected that hospital ICU capacity could be overwhelmed by the end of December. So just in another month or two. You can see what hospital admissions looks like, continuing to increase, and not just increasing, but we're seeing older adults, once again, being admitted to the hospital. So for those younger adults who feel like, you can withstand the symptoms of this virus, keep in mind that you can asymptomatically transfer it to someone who might not fare so well, someone who's immune compromised or older individuals. I want to just share some of the numbers here. You can take a look at all the compliance visits, and I want to reinforce that this is not about enforcement. This is about getting our numbers down and everyone contributing. You can look at the number of compliance contacts that we've conducted since the beginning of this pandemic, and only 222 citations were issued for egregious violations. That's going to be our continued approach moving throughout this. Just those egregious situations, we're going to take a strong look at and do what we need to do to get them under control. 222 citations, that's about 1% of all of the visits that we conducted resulted in an enforcement action. A big part of our effort is to get on outbreaks as soon as they're reported to us. That's clusters of cases wherever they might be, to put controls in place so that a few cases does not become a few hundred. And we've been very successful at doing that, although outbreaks are coming in daily. Outbreaks are being reported to us daily. We're keeping up with that, but it's becoming increasingly difficult with our case management and outbreak investigation system. Since the Pepsi Center stood down, we're very pleased to report that over 20,000 tests have been conducted at our static testing sites, and I'll get into where those are and what our efforts are going to be moving forward. Our Wellness Winnie continues to operate, and I can't stress this enough. If you can't get to us, we will get to you. Call the 311 call center. You'll be connected with one of our personnel, and we'll get a time scheduled that's convenient to you to come out to your home, get you tested, get that sample to the lab, and get the results back to you along with guidance if you are positive. Just a recap of some of the things that the mayor's touched on. The Home by 10 order will be in place from 10 p.m. to 5 p.m. There's a number of things that it exempts, of course, critical businesses, employees returning from home, people that are traveling through Denver, traveling to Den, first responders, school systems. This does not apply to those. What this is geared at getting at are those public and even more so those private social gatherings where large numbers of households are gathering in private settings. That's what we're really trying to target with this. To the mayor's point, this will be suspended on Thanksgiving Day. And just like the mayor, I'll be spending Thanksgiving with the two people that I live with in my household. I'll be reaching out to my family members to talk with them on that day, but it'll be just the three of us. I want to talk a little bit about our fixed community testing sites. As a reminder, CDC recommends that the city as a whole conduct about 1,100 tests or so every day. We are far exceeding that, over 3,000 tests being done a day, a large part of that just being done by the Department of Public Health and Environment. These are static testing sites, but this is not the only testing that we do. We do community events and outbreak testing and the like, just to make sure we're doing everything we can to find out where our positive cases are. We're looking at a fourth location to offload some of the overflow that we're seeing from Paco Sanchez Park. You know, we've said for quite some time now that, you know, the Pepsi Center stood in the gap, but we need to get into communities, particularly underserved communities, because we know that there is a higher prevalence of positive cases in those that identify as Black or those that identify as Latinx. And we've done that. 3 times the number of people in those communities are being tested now versus being tested at the Pepsi Center. We'll continue to move our testing efforts forward. Where can you get tested? We would encourage people, given just the volume of people that want to be tested now, reach out. If you have insurance, reach out to your primary care provider or urgent care facility and get tested there. If you don't have insurance or you're underinsured, visit one of our sites and we'll get that testing done for you. And then again, if you're homebound, we'll come to you to get that done. We're looking at innovative ways, given the number of cases that we have right now, looking at the use of a new rapid test that can provide results within 15 minutes, looking at ways that we can deploy that in a wide range of settings to get at those asymptomatic, particularly the asymptomatic young population who is spreading that at an increased rate. The other thing I want to share is that recently there was a phone app that was put out by Google and Apple, and you can download that app. Here you can see the link to that. Download that app to your phone, and you will be notified if you were in close contact with somebody that was tested as positive. If, hopefully you can see this here. If not, I'll show it a little bit later, but I have it on my phone here, and I open it up and it tells me that I've not been exposed. This app does not transfer anybody's personal information. It does not collect any personal information. All it does is notify you that your phone may have been in close contact with another person's phone that was tested positive. There's no transfer of information, very, very confidential. So in wrapping this up and moving to the Q&A process here, I just want to reiterate that we can get this under control, but we all have to contribute. We all have to adhere to public health orders, gather with members just in your household. Remember to wear that mask, wash your hands, stay at home when you're ill. Download this app and respond to contact tracers if we're reaching out to you to let you know that you've been exposed. And with that, I will turn it back over.
All right, Teresa, we'll go to question and answer.
And I wanted to let the group know I had to mute manually everybody just because we had some folks whose audio was bleeding through. So you're going to have to *6 to unmute, likely most of you, if you do have a question. And I would just ask you to be respectful, go one at a time. And we just have to remember to mute our phones when we're not speaking. So with that, I'll go ahead and open it to any questions.
Hey, Bob, this is Conrad over at the Post. I had a quick question for you. I know you use a lot of different metrics to measure what's going on or what level of restrictions the city needs to be using, but with a lot of them already at stay-at-home levels, can you explain to me why you think this curfew will be effective? and not just waste time for between now and what a lot of people see as possibly an inevitable stay-at-home order?
Well, I don't know that it's inevitable that we're moving towards the stay-at-home order. We're going to work closely with the state. It's a real possibility, but the effort here is to do everything we can to drive numbers down and to stay away from a stay-at-home order. I will tell you that this is the last effort here, and everybody needs to contribute with these orders. There is no easy silver bullet for this virus. It spreads very, very easily. We need to do everything we can, including those things that are outlined in this new order. Hopefully this does it. Hopefully everybody contributes and we'll get it done. But we'll have to see what effect it has. Certainly adhering to it is a big piece of that.
Conrad, thanks. Next question.
I wonder if you could elaborate a little bit on what enforcement is going to look like.
I think that's Donna, right? Thanks, Donna.
Yeah.
Yeah, this is an order, but I want to reiterate that this is not about issuing tickets. It's not about closing businesses. We adopt it as an order because we want it to be actionable, but we only use it in the most egregious situations. We receive, even still, this far down this path with this pandemic, a dozen or more complaints every day about situations in which people are not complying or large groups are not complying. If we didn't have the teeth of this order to back us up, we would struggle with nothing else but to go to that venue, to go to that group of people and say, we really encourage you not to do this. That is not going to get us there. But again, with 1% of our visits resulting in enforcement, I think we've been used it with great discretion. It will only be used if necessary for the most egregious situations. We're going to work closely with the Department of Safety. I want to thank Sheriff Diggins and Chief Pazin for their cooperation and Director Robinson. They'll be working closely with us to facilitate as much compliance and adherence to these orders.
Thanks, Donna. Next question. Do we have any more questions? Remember to *6 to unmute.
Yeah, Bob, I got one more just to kind of follow up on my first question. This is Conrad with the Post again. I mean, can I get you just to elaborate just a little bit more on your thoughts on whether or not pushing off a possible stay-at-home order wouldn't just allow cases and hospitalizations to surge for the rest of the month? Does that make sense?
Yeah, I understand the question. I don't know that my answer is different than what I provided before. Every step of the way, we've tried to use discretion with our public health orders, because every one of our public health orders, we recognize it has an impact on people, on their physical health, if there's certain things they can't do, certainly on their mental health. We recognize that, but we also recognize that those impacts are even more so with a stay-at-home order. So I think it's the right thing to do to put everything in place that we can to avoid a stay-at-home order. I'm hopeful that this will do it. Again, it's very dependent on everybody's cooperation with it. Hopefully we can avoid that stay-at-home order, but time will tell.
Conrad, thanks. Any more questions?
Yeah, hi. Go ahead, man.
This is Jesse at the Colorado Sun. Two quick questions. One, I wanted to see.
This is Donna again. Are there any penalties associated with being out after 10?
Oh, one sec, Donna. We had a question that was being formulated. Go ahead from Colorado Sun.
Yeah, thanks. This is Jesse at the Colorado Sun again. Two questions. One, are you guys recommending that folks no longer go to restaurants and retail businesses? I understand those are still open, but is that something that you're suggesting people don't do, since you're telling people not to mix in households? And the other one that I wanted to ask too is escaping me at the moment, so I'm going to not ask.
So the answer to your question is no. That's not what we're saying to people. We're encouraging and urging folks. First of all, know that businesses are going to close at 10. To plan accordingly. And thirdly, make sure that when you are going out, that you are with your family unit. The best way for us to, again, to stop the spread of the virus is to stay within your family unit as best as you can. And we understand that, Bob and I may need to get together and have a conversation over coffee, over a cold beer maybe, but it's limited to just us two. And no third outside or third household can be joined in with that. And so we're asking folks to be thoughtful and to understand that they have a responsibility to manage their gatherings in this process. It's the only way we're going to get on top of this curve and begin to get back in the right direction. Bob, you want to add anything to that?
Well, I just, I really appreciate the question, because the longer this goes on, again, we recognize the impacts that this has on everyone. But I would encourage everyone to focus on everything that we can still do that we wouldn't be able to do in a stay-at-home order. Go shopping for the holidays, take a walk in the park, go for a run, a bike ride, a hike. Go to your favorite gym. There are so many things that we can still do. We just need to do them safely, with your household, and with face coverings on. So I just want to reinforce that, because again, we recognize the impacts that public health orders have on everyone.
Sorry, I did remember my second question. What proof do you guys have that enacting this order will actually slow transmission of cases?
Yeah, thank you. What proof do we have? Again, this virus is not easy to identify in terms of its transmission with, unlike other things like influenza and other types of infectious diseases, there's a high rate of asymptomatic people. What we do know is, that it's important to look at data. It's important to look at where we see noncompliance. It's important to collaborate with the state health department and regional partners to see what they're seeing. If there was an easy way to get this done, it would already have been done across the country. But I had seen this morning that there is no state in this country that is seeing a decrease in cases. So we're going to look at everything that we can, make educated decisions, and hope that gets the job done. But there are no guarantees with any of this, or things would be a lot easier if they were. I appreciate the question.
Donna, you had a question again?
Donna's question, and I'll just ask it for her, Mayor, because I'm texting with her. I think her phone was breaking up a bit. But what she wanted to know is, are there any penalties attached to being out and about after 10?
Well,
go ahead, Bob. I'll let you answer.
Oh, sure. Any violation of a public health order, a person runs the risk of a ticket to court. That's true with all public health ordinances and laws in the city of Denver. That carries a $999 potential fine and 300 days in jail. I want to just reinforce, though, that hasn't occurred to date. I don't know that anybody has received a $999 fine, and certainly no one has been put in jail. The order is in place, again, so that we have some tools to address the most egregious violations, but we're not out actively going door to door to make sure that everybody is complying. I expect to see a high level of compliance. I believe we've messaged this enough that everybody gets it. And I'm hopeful that we're still going to keep those situations where we need to conduct enforcement to a minimum.
Hi, this is Liz Gilardi with Denver 7 News. I was wondering, Mayor Hancock, you're hesitant to call this a curfew, but when people hear that they need to be home by 10 o'clock, they automatically associate it with a curfew. Is it a curfew?
We are strongly urging folks to go home at 10 o'clock. And we're strongly urging folks to not go to households that are not their own, and not to have multiple households gathering in your home, or you gather somewhere else. Again, this is about personal responsibility. A curfew is a public safety measure used to keep the general public safe from a known threat. What we're using is a public health order that we recognize will hopefully keep people safer, healthier, and to make sure that no one else is placed in a precarious situation. So you're not going to hear me talk about curfews. You're going to hear me ask people to take personal responsibility, be home by 10 o'clock, and not to commingle households.
Hi, this is Seth at the Denver Gazette. I guess I'm confused about.
Hi, Mayor. This is. Oh,
Oh,
sorry.
well, stop. We had someone, Denver Gazette, keep
No.
going.
Thank you. I guess I'm a little confused about if it's a requirement that people, not restaurants, but just people be home at 10. I mean, there's talk about enforcement, but then you guys keep using the word strongly urge, which doesn't sound like a requirement. Can you clarify that?
Yes, I can. So, for example, you can be in a restaurant up until 10 o'clock. Well, we ask people to be home by 10 o'clock. So we ask you to plan ahead, plan to enjoy your dinner with your family, and be home by 10 o'clock. If you decide to go walk your dog at 10:15, 10:30, 11 o'clock at night, that is not something that we are concerned about in this order. What we're concerned about is the public commingling after 10 p.m. If you decide to go for a run, and someone used an example today, if you decide to go for a run at 11 o'clock at night, that's not something we are talking about in this order. But we're certainly not going to permit during this order for someone to be in a restaurant or bar, and they should be closed. Liquor store. If you're going to work at 10:30, that's permitted in this order. So if it was a curfew, you going for a 10 p.m. or 10:15 run, that would be a concern. That would be something enforceable. That's not what we're talking about in this order.
Okay, another question? Any other questions? Got a few minutes left.
Mayor, this is Chris Vanderveen from 9 News. I want to ask you and Bob this sort of the same question. Whoever wants to answer, it's fine. I want to make sure I'm hearing you right when you say that we're sort of out of options here. Are you suggesting here that this really is the last tool in the toolbox here, and that if these measures do not work, that we are going to see a stay-at-home order in place in Denver?
Mayor, would you like me to answer that?
Yeah, why don't you go first, and then I'll commentate afterwards.
Yeah, sure. No, I don't think that's what's being said here. You know, again, going back to what I said earlier, we want to do everything that we can to avoid that. But we've implemented a lot of things, and this virus is very difficult to control. So there are no, there's no definite path to how we get these numbers down. I don't know that a stay-at-home order is imminent, but I know that we've implemented a lot of strategies to try to get these numbers down. And if we run out of strategies, that could be possible that the state would place the city of Denver or perhaps the entire state under a stay-at-home order. So we're just going to have to wait and see how these strategies work. And we would encourage the business sector, citizens, everyone to send your ideas into this. We need to be innovative here. We're going to try to do everything we can with innovation to get where we need to be before we get placed into a stay-at-home order.
I just wanted to add a couple things with regards to that question, and I really do appreciate you asking the question. I think it's important to note that in March and April, when we had to do the stay-at-home order at that point in time, there was a lot we didn't know. There's a lot we had to learn, and quite frankly, there was a great deal of uncertainty and concern within the public with regards to this virus. We still have a great deal to learn, but we also have learned a lot. And in talking with Dr. Birx and others, my instinct and all of our instincts have been confirmed that you want to avoid a stay-at-home order if you can, and do measures differently to, one, help people remain active in their life, to keep the economy moving forward. For example, I talked about restaurants closing at 10, but you may also go to pick up curbside, drive-through, and have delivery after 10. Our restaurants are allowed to continue to do that. They just cannot have in-person or in-house dining. But there are no alcohol sales permitted after 10 p.m. But here's the reality. We are balancing the health and safety of the public while also making sure that we don't rip away, once again, the ability for people to care for their families. And people, I can tell you that that stay-at-home order was very important. It was impactful in terms of helping us get on top of this virus. We bent the curve, but we know a little more now, and we can also do multiple things at once, including keeping the economy at least alive to keep people working and able to care for their families. But we need personal responsibility, and that's what we're leaning in on, a bit of sacrifice from all of us in order to I think, get handle on the spread of this virus today, particularly when there's the other virus, the flu virus is in society. So the twindemic is what we're really wanting to avoid right now and to save lives.
Any other questions for the mayor or for Bob McDonald?
Hi, this is Jeff Cook from ABC News. I'm wondering when a
I was just going to ask.
Hang on 1 second.
Hold one moment.
Hang on.
Sorry.
Sorry, Jeff Cook from ABC News. I was wondering when a complaint comes in, let's say, of a house party going on, who exactly is showing up at the door to enforce this? Is it a public health official? Are they accompanied by law enforcement? What exactly would that look like?
Yeah, so complaints could come in a number of ways. It could come in directly to the department, to 311, or what have you. The police department in those situations are partnering with us, again, using great discretion, responding to those situations, educating, warning people what to do, providing guidance. So our partners in the Department of Safety will be responding to much of those.
There was another question. We'll take one more, Teresa.
Yeah, I think it was mine. This is Ed Seelover with the Denver Business Journal. I just want to ask Bob to elaborate on what are the essential businesses that are allowed to stay open after 10? For example, are grocery stores going to be open after 10, or who in the city will be open after 10 o'clock under this order?
Yeah, I don't have a comprehensive list. I appreciate the question, but certainly grocery stores, pharmacies, essential manufacturing businesses. We're going to put something out, an FAQ here soon, and more information on that, and that will be detailed on our website as well. It's many of the same types of businesses that were allowed to stay open under the stay-at-home order back in March and April.
The airport will remain open, medical facilities, of course. Thank you all for joining us this afternoon. Thank you for your great questions, by the way. And let me just close on this. I know there are a lot of questions and back and forth in terms of terminology, rather than, the home by 10 order versus a curfew. Again, I'm asking you all to join with us in finding the right way to describe this, that curfew is not what we're trying to promote to the public. We're trying to promote personal responsibility, urging folks to be home by 10 to help us all do what's necessary to get on top of this, the spread that we are seeing, particularly with asymptomatic individuals between the ages of 18 and 35, while at the same time preserving people's ability to care for their families and take care of their families. So I know that call us if there are any additional questions with regards to that, but the last thing we need in the public sphere, and particularly promoted through media, is this battle. Is this a curfew? Is it not? At the end of the day, it's about saving lives, and that's what we're working toward through this particular order. Thank you all.
And we'll be sending out a copy of the order as well, attached to the press release after this. So yes, as the mayor said, just feel free, reach out to us and we'll answer and follow up with you any questions you might have. Thanks, everybody. Thanks, Mayor.